There are scenarios in clinical practice that are particularly tricky, but speaking with people that are particularly angry or furious can be some of the most difficult conversations we have. Today, we'll be going through how we speak with people that are particularly angry and how we can make that conversation go as well as possible. Welcome back to Clinical Communication. My name is Ben. I'm a specialist physio and clinical communication skills educator here in the UK. And today we're discussing how do we speak and manage people that are angry in our clinical practice. As I said, this can be one of the most difficult conversations we have because of all the emotions involved. And there is other conversation and communication skills training out there, but not much really deals with how to manage angry patients, which leaves the clinician who doesn't know quite in the dark and in a very difficult situation to try and manage. So today we'll be going through what to do and also what not to do to help manage that conversation as well as possible to get the best outcome for everyone. To help with this, I'm going to use a story of a real life situation that happened to me a few years ago now. We're going to say there is a lady, we'll call her Helen. Helen has come to me with her persistent leg pain, and Helen is very angry. She's now awaiting surgery that she's had to fight for many years, but she's on a waiting list with no date, and she's furious that no one has cared and no one has been interested to try and help her at all. She's shouting, she's furious. And this is often the case with anger. We often worry that patients are angry at us, but a lot of the time they're probably angry at someone or something else that happened in the past, and they're now able to vent it or let out their frustrations to the person in front of them. Maybe because you work for the same service, maybe because you're a healthcare person, they feel able to vent out to you, or you just show some similarities because you work for the same service. Who knows? But often they aren't angry at you, especially if they haven't met you before. And I will say, before we get into all of these techniques and ways of managing the conversation, if at any time during this conversation with an angry person you do not feel safe, or you do not feel that the conversation is becoming productive, you can end it and walk away, or ask them to come back for another time. Always put yourself first. There will be many, many patients that will come through to see you over the years, but you will always have you. So put yourself and your well-being as a priority. So what do we do with people that are angry? If we do feel safe and we do feel that the conversation will hopefully become productive, how would we manage this? Well, what did I do with Helen? First step, let her vent. With most people, if you can let them vent and say whatever they want to say and get out of their system, a lot of them will immediately calm down. They will simmer once they've let out all the air and all the feelings inside of them. It's not a guarantee, but that is probably first step number one. In her case, she just wanted to tell me everything about the story and everything that had happened, why she was so angry at her situation of not being listened to in the past or people not caring. And as they're in between talking, in between paragraphs and sentences, we're going to pause. We're not going to fill it. We're going to let them pause and breathe out. It's an easy way to let those emotions and those heightened feelings simmer. It gives them time to reflect and just lets the emotion and energy come down. And as we're talking, as you can hear me doing a second ago, I'm going to gradually slower my voice to help that. I'm not going to go so slow and so far away from her that it's not matching where she's at, but a calmer, slower tone will in turn help her gradually come down to that level. If we're listening to them, if we're showing attention, we're building that relationship, they're then more likely to start to copy us and what we're doing. So if we can be gradually slower and calmer, they'll start to come that way as well. As they're talking, as they're letting out their frustrations, to help facilitate that calming down of the energy further, we're going to use some empathetic labels. Things we discussed in the past. There's another episode on this, on how to demonstrate empathy. But if you can demonstrate empathy with someone who is frustrated and angry, and showing that you're trying to understand their experience, that again will help them gradually calm down, help them feel that you are understanding what they've been through. You're not stating that you are agreeing with their experience or agreeing that their reaction is appropriate, but you're just trying to show that you've understood. And again, it will help them simmer down gradually. How we can do this is with empathetic labels, like I discussed in the previous episode. So with Helen, I let her tell her story, let her get out her frustrations. I repeated it back to show that I'd heard and taken in what she'd said. And I said something like, "This must have been all really difficult for you. This must have been really hard not feeling heard. And again, the tone I'm using, slower, calmer tone, gradually helping her calm down, but also showing that I'm understanding her experience. And again, it's an easy way to help manage these angry situations. As Helen was talking, she was telling me her story, and I've repeated it back, and I'd tried to demonstrate some empathy. We also find things in agreement. So if someone's been through an experience and they're frustrated by it, and you feel that they have a right to be justified for their frustration, you can say. So I said to her, "Oh God, that is quite a while I've been waiting on that waiting list." I'm backing up with what her experience was, and I'm showing some agreement. You don't have to agree with what they say because you may not. But if you feel that the anger or the frustration is justified, because it can be, not all anger is wrong. People can be very justified for their angry responses. You can show where you agree. What you don't want to do is enforce that anger too much, as we'll come on to a bit later. And the final do for managing the angry person is, where appropriate, to apologise. And while I said earlier that most of the time they're not angry at you, they're angry at the situation or someone else, an apology can still help. So with Helen, I said, "I know this isn't my fault, but I'm really sorry you had the experience you had." Now, she knows it's not my fault. I know it's not my fault, but the apology still helps. Even if you work for the same service, okay, or the same environment, it just helps, again, that person feel that you're trying to understand them, trying to show some empathy and sympathy in that case. And as I said earlier, if you can give them the space to vent, let out their frustrations, and demonstrate they're trying to understand their experience, they can be the best things that you can do to help that situation calm down. However, there are some important don'ts, and the don'ts are probably more important than the do's. The do's, I suspect, you can already do, like the listening and the empathy. The don'ts are the more important parts. And the first thing is, when you have an angry person in front of you, do not get angry yourself, because all you will do is add fuel to the fire. If you start shouting and talking loudly, all you're going to do is subconsciously emphasize that their behavior is acceptable, and they're going to get louder and angrier as a result. You can be firm and you can be clear and attentive. But if you start shouting over them, they're just going to shout back even more, and the situation will get worse. So don't try to outshout them. Give them your attention. You can be firm, but don't try and exacerbate the situation further. So with Helen, if I'd have been talking really loudly or even shouting back at her, I could have been saying all the right things, but my tone and my voice may have made that conversation much less productive. Hence why it's so important that with these people, you gradually slow down and use those pauses. The next thing with this person who's angry in front of you is, don't use negative labels. The classic one being telling them you're being angry, or you're shouting too loud, or you're reacting too much, because that's a very generalized statement. Okay, be specific, as I've said in the past. If I'd have told Helen, "You're acting really angrily to this probably would have exacerbated her anger further, because I've labelled her, and often when you label people, they will then begin to act out or exacerbate that label even more. So avoid the generalising negative statements and just focus on specifics, and again, letting them get it out, and then showing some empathy and positive statements when appropriate. Also, try to avoid any blame or negative assumptions about the person who's angry. Their anger can be justified, as is the case with Helen. I could have assumed she was a bad person because she was frustrated, but she wasn't. She was actually, in the end, a very nice person, very easy to talk to. But her experience had made her angry, and that was okay. So don't just put blame on people because they're expressing frustration or anger. And finally, avoid the term calm down. Think about it. If you've ever been in a conversation with someone who's angry, when has the term calm down ever actually calmed that person down? Imagine it with Helen. If I'd have told her, "You know what, Helen, you just need to calm down," what would she have said? She'd have said, "Calm down? You've heard what I've been through. How can you expect me to calm down?" Often, it just makes them more angry or more frustrated. So, with anyone who's angry in front of you, avoid calm down, let them vent, and then give them time to simmer down over time. But as I said earlier, if you're speaking with someone who's very angry or frustrated and you do not feel safe, or the conversation is not becoming productive after several attempts, then walk away and come back to it later. Doesn't have to be that day, can be a different day, different time, whenever's a better time for you in the service. but you don't have to sit there and endure it if it's becoming more of an emotional toll on you. If you'd like to know more about how to manage difficult conversations like these, or particularly with anger, then I recommend 2 books for you. Number 1 is How to Have Impossible Conversations by Boghossian and Lindsay. And the other one is How to Deal with Angry People by Dr. Ryan Martin. Both of them are very recent books, both of them very good reads. As before, if you found this useful, please do share it with others. Please do find me on social media at BYBrowPhysio, and please do contact me to let me know what guests to get, what topics to cover, and what would make this better. Thank you for listening or watching, and I'll see you next time.